Hello, and welcome to Timing is Everything, a program of Care Dimensions, formerly Hospice of the North Shore in Greater Boston. My name is Mary Crowe, Education Specialist at Care Dimensions. Today, I am thrilled to have as a guest Eileen Dacey, who is the Program Manager and Clinical Specialist of Hoarding and Cluttering at North Shore Elder Services. Eileen, welcome to the program.
Hello. Well, thank you.
Yeah,
thank you for
happy
having
to have
me.
you here. So tell us more about your role at North Shore Elders.
Absolutely. So I am the Program Manager and Clinical Hoarding Specialist for the North Shore Center for Hoarding and Cluttering, affiliated with North Shore Elder Services here in Danvers. I offer clinical support for individuals struggling with varying hoarding issues. What that looks like is providing in-home or in-office counseling, facilitating support groups for individuals and even family members, consultations, trainings, and even crisis management.
Wow. I'll tell you, this is such an important topic, and I know that, when I first spoke with you about this, it's just amazing. There's just such a lack of understanding and stigma around this, and I really think this is so critically important that we have a better understanding of this. So can you talk more about hoarding and hoarding disorders?
Absolutely, and unfortunately there is a lot of stigma associated with hoarding as a whole. And I think that it's important for me to start with just underlining what hoarding is not.
Yeah.
So hoarding is not contributed due to laziness. It's not a moral issue. It's actually a mental health diagnosis called hoarding disorder, and it's defined by three main components. Now, hoarding disorder is really due to the persistent difficulty discarding with or parting with possessions, regardless of their actual value to you or I. There's also clinically significant distress associated with thinking about parting with possessions or perhaps even donating items. And symptoms, and now this is going to be the most visible component of hoarding disorder, which is the clutter, can contribute to the congestion or accumulation of active living areas within any room, to the point where it might even create safety hazards within a home.
Wow. Yeah, I think that, again, people are kind of under this impression that it's just, we're just collecting items, and it's so much more than this.
It absolutely is.
Yeah. So, is this associated with other mental health issues?
So there are a couple of other comorbid or co-occurring mental illnesses associated with hoarding disorder. The most common ones are depression, anxiety, attention deficit hyperactivity disorder, and obsessive compulsive disorder.
Yeah.
In fact, approximately 92% of individuals with hoarding disorder also have a comorbid disorder.
Wow, that's a high percentage.
It is.
Wow.
It is.
Does this tend to impact a certain age group more than others?
Average age of treatment seekers are roughly in their 50s, although hoarding behavior can actually develop and begin in adolescence. And although it's incredibly difficult to diagnose in young children, you think about caretakers, guardians that are involved imposing particular rules about how a child should upkeep their home or their environment, for example. But again, it's typically someone who's in their 50s.
Wow. So, when do people generally identify themselves, or are other people identifying them in terms of, having an issue around this?
That's a great question, Mary. I do get a mix of different referrals. So some people will refer themselves, stating that because of the distress, they don't want to live like this anymore, for example, and they really want to get involved in treatment, or they want some of the benefits associated with being involved in a support group. Although other people will refer on behalf of the individual, so it might be concerned family members or loved ones, even particular authorities such as housing, landlord, even Board of Health.
Wow. What types of things do people hoard?
So it's important to note that we all collect different categories of items, right? So some of the most common things that people with hoarding disorder will hold on to might be clothing, paperwork, gifts. Now that's gifts that they intend on giving someone as opposed to gifts received. The categories that we typically hold on to might be things of sentimental reason, instrumental reasons, so there might be an intended purpose for that particular possession, intrinsic reasons as well, so something that has an aesthetic value associated with that particular item, and even security reasons. So you never know what if I might need to hold on to some candles, flashlights, batteries, things of that nature.
But like you say, it's, you know, we do all collect things, but it's different, right? You know, and I certainly have certain things that I keep for sentimental purposes, like you say, but this is so different.
Yes, you're absolutely correct. So the difference really contributes to the intensity and rigidity associated with holding on to the possessions in larger and greater numbers.
Yeah, yeah. Is there, you know, because one thinks that there, again, an individual who has hoarding behavior, that is it the hoarding behavior that helps with the anxiety? But what you are also saying is that the hoarding behavior can cause distress. What a terrible, you know, conundrum, really.
Yes, it can be a conundrum, right? And it's almost, if you could think about it, like the chicken or the egg sort of debate. You know, hoarding can create a lot of sense of safety, even coping for a lot of individuals. But on the other end, it can create a lot of distress, where people might become discouraged by looking at their environment and seeing a lot of clutter and stating, you know what, I want to start making some changes in my life.
Wow, wow. I mean, it's amazing that people can, again, you know, get to that point where, again, they can reach out and identify this themselves.
Absolutely.
Yeah. So, what do you do? I mean, what is the treatment approach here?
So, you know, according to research, particular treatments that are most effective in treating hoarding disorder is probably going to be cognitive behavior therapy as an evidence-based approach, which is really going to focus on modifying behavior and implementing skills and strategies. So when I'm sitting with someone and I'm providing psychotherapy, we're sorting and discarding as well, okay? And the modifying behaviors is also, we're going to be focusing on maintaining those new behaviors. So at some point, an individual might be able to maintain those newly acquired behaviors individually.
Do you find a high success rate?
I find different results, I'd state. Some people, we have a high recidivism rate with our support groups. Members like to come back because it does increase a lot of socialization for our folks. But I'm noticing great differences in acquiring and implementing those newly found skills and strategies.
I want to get back to the strategies and the treatment approaches, but so what percentage of the population suffers from this disorder?
It's a great
these
question.
disorders,
yes.
I should say.
So with hoarding disorder, this is actually an incredibly common condition, and it affects anywhere from 2 to 6% of the U.S. population. So it's roughly 15 million people in the U.S. alone.
Oh my gosh.
Yes.
That's really staggering.
It is staggering. So according to research, that's 1 out of every 20 people might have a hoarding problem. And it's important to note that this is a cross-cultural phenomenon. It does not just impact Americans alone, right? However, scholars believe that this is an underrepresented amount of the actual figure, and that's due to self-reporting. Not everyone who hoards is going to be so forthcoming that they might have a problem, and that might be due to shame or embarrassment or even fear of being reported by authorities.
Yeah, wow. Well, that makes sense with the stigma like you talked about earlier. So, you know, again, let's get back to some treatment approaches too, because I think that people are under the impression of, you know, you know, just get in there, grab everything out of there, clean the house. That's what they think. It's, you know, it's all this clutter and this and that, just kind of this excessive clutter, and then everything's fine. Talk about that. It's just so much more, isn't it?
It is so much more, and I will say that I do oftentimes get some of those phone calls of, Eileen, why can't we just do a full clean out? Then the problem would be resolved. Unfortunately, it doesn't. That only solves part of the component, right, which is just that visible part of hoarding, which is the clutter, but you're not addressing the underlying behaviors or emotions or attachments to those possessions. So it's likely that the behaviors will continue. In fact, cleanouts yield the highest rate of recidivism of anywhere from 98 to 99%.
Wow, wow. So again, like you said, so you're really having to do some of the deeper work around what is the root cause of this, getting to that with the psychotherapy like you're talking about, while you're doing the cleanup for that to have a better impact, right?
Yes.
And that's where the less recidivism would come about, is that?
Yes, I will say that I highly discourage cleanouts, although I know that sometimes they're necessary.
Yep.
And although I tried to advocate on behalf of the client that I'm working with of trying to go a different route, perhaps by doing a bit of harm reduction, having a plan set in place prior to that event happening. But if any sort of clean up or clean out were to occur, it's vital that a clinician is present, someone who's highly skilled and trained in treating hoarding disorder.
Yeah. So that's another question, because I think, you know, there are a lot of wonderful clinicians out there, well-intended and all of that, but I think, like other things, that people don't understand the unique issues here, and really kind of have this specialized training. So do you see that a lot, where you know, whether it be nurses, social work, other disciplines will go in and just think, again, they're going to just take care of this, you know, there's obstacles in the way, there's safety concerns, so they just, again, they're approaching this in all the wrong way.
Perhaps, and I think that they're well-intentioned concerns, that they want to make sure that the resident safety is of the utmost importance, which it should be. However, you still have to consider, because it is a mental health diagnosis, that we have to treat it as such.
Right.
And it's not just going to be about cleaning up the clutter, it's about really supporting the individual and making sure that we can be as supportive as possible to them, and treating it just like any other mental health diagnosis out there, whether it might be bipolar disorder, schizophrenia, or any of the other ones.
Sure. Well, you talked about cognitive behavioral therapy. What other kind of interventions do you have?
So it depends on the mode of treatment for the individual. So if they're involved with me and I'm providing counseling, CBT or cognitive behavior therapy would be the route to go.
Okay.
However, if I'm working with someone through a crisis case management lens, that means that we have a fixed duration of trying to achieve minimum safety and sanitary requirements, make sure that all fire hazards are eliminated if possible. I'm going to use some of the other modalities, might be motivational interviewing or solutions-focused brief therapy, as we're focusing more on the here and now.
Okay. So it's not, when people think of hoarding, I think they think of just like newspapers or whatever it is. There are different types of hoarding?
There can be an array in terms of severity, okay? And so if you're seeing perhaps in more severe cases, that's where you're going to find perhaps structural damage, really severe fire concerns within the home. But you also want to consider the level of insight the person is demonstrating. So someone who calls and refers themselves to our program, they might have great insight. So there's an awareness that a problem exists and they want to work on it. However, in severe hoarding cases, it's likely that the person might not have a lot of insight or awareness that there's a problem, despite evidence to the contrary.
Do you have, I would think, again, if somebody self-refers, is the success rate better?
Typically, you know, if they're being involved with our program through a crisis management lens, my focus isn't really going to be on modifying the behavior, it's about minimizing the risk. And I would do that through a harm reductionist lens.
So, in terms of, you had mentioned, so again, this isn't like just around those sort of things. So talk more about kind of other things that you kind of come across, or do you even have some case examples that you can even say briefly, with obviously without using names? So
when thinking about hoarding disorder, it's important to note that this is a chronic and progressive disorder, and that's why treatment would be focusing on behavior and maintenance long term. And so that's why we do have a lot of clients who stay with the program for quite a bit of time, or they feel that they're able to maintain on their own and they move on. Hoarding, you can kind of sort of define it in a couple of different ways. That someone wants to hold on to something because I'm going to keep it, or they're saying I want to keep it, but I might not necessarily have a purpose for it. However, I might down the road. So they might find a particular attribute or something very special about that item. So I'll give you an example of some bottle caps, for example. And I had a case not too long ago where the individual I was working with was holding on to orange bottle caps. And the more I started to ask her about it, she told me, well, she liked the color, the texture, and the size of the bottle cap. And her intention for saving them was to create a dollhouse, make a dollhouse, and donate it to her nearby school so that children could play with it, because she loved dollhouses as a child.
Yeah, so interesting. Do you have other case examples too of kind of particular things that you've come across in terms of your work?
Yes, I mean, you know, if we're thinking about perhaps grief, so hoarding behavior is typically triggered by trauma, loss, perceived loss, or even stressful life events. And so the more, again, it's really about expressing curiosity when you're talking with someone, not just tell me about the stuff. Tell me about your journey. Tell me a bit about you as an individual, because I know that I want to be treated that way myself. So perhaps a client that I worked with before was holding on to things that was given to her by her mother, even her mother's clothes. And even though they didn't fit her, she wasn't intending on wearing them at any point in her life. She wanted to hold on to them because of that attachment, that sentimental value reminded her of her mother. And for someone to come in and state, you need to get rid of this now, that means that she'd really have to recognize that her mother's no longer alive.
Wow. See, that's what you know, there's so much more to this. So again, what is that symbolic, you know, how does the symbolism affect that person? So clearly in this case, what does that mean for the person to relinquish or let go of that if it's around an issue around grief or an attachment to a person or another item like that? That's really important for people to understand. I was going to ask you about, like, what is the time frame in terms of treatment, but it must vary.
It does vary. It varies on the person and the stage that they're in terms of motivation and wanting to work on the issue. So it could be anywhere from perhaps 26 sessions or even a bit more brief. Again, really case dependent.
When you say, like, so if you're doing 26 sessions, is it like once a week, or is it?
So I typically see individuals weekly or even every other week, and it depends on their schedule and when they feel that they can accommodate me within their lives, their busy lives.
So people who are hoarding, are they out there? Are they working? Are they, you know, are they entrenched in society? You know, give us a profile here. Is there a profile?
So unfortunately, there's not a profile, and I'd say that that's a good thing, because you can't go out looking to find somebody who hoards, right? There might be you and I, right? They're walking around everywhere. We're all people with unique needs. Although I will say that with hoarding disorder, it's common that you're going to find an increase in social isolation, again, because of that shame and embarrassment, and to a certain extent. So if someone's out in the community, they're very social, it stops at a point because they feel that they can't bring people back to their homes.
Yeah, absolutely. So, well, there's the stigma and the, you know, that sort of thing that comes in again. You know, as you know, we care for people with advanced illness or at end of life, you know, and there's a lot of work to do at this stage of life, and a lot of times, you know, there's unresolved issues, and there's all kinds of things that we can work on with people here, you know, and I wonder, again, you know, we care for people who have hoarding disorders, but how do you find that it may complicate it for people in terms of kind of their being able to resolve things at end of life or with an advanced illness, that sort of thing? Do you see any difference in that way, or?
So it's important to note that the emotional distress is almost always there, regardless of what stage the person is in. But if perhaps they're at the end of life, or they're also managing and facing advanced illness, it does make things a bit more complicated. And some of the common things that I hear from some of my clients that are at that stage is that they'll state, you know, I don't want to leave this for my loved ones to deal with. I'd prefer to go through this myself and make decisions about what I'd like to keep, or even pass on to some of my loved ones as well.
Wow. What happens for people, again, so they're surrounding, and again, is it generally in their own personal home?
That's a good question. It's typically in their home, although things can sort of be stored in storage units. Their people might have a couple of different properties as well where you're going to find hoarding. And even homes or cars, mobile homes, things of that nature as well. If areas are being maintained, it's typically due to a third party, so it might be spouse, family members, even hired agencies such as homemakers, home health aides, things of that nature.
How about when people have to, let's say that they have like an acute illness and they need to go to the hospital, or they need to maybe sometimes even have to go for rehab or a long-term care or something like that. What is that like for somebody who has a hoarding disorder to have to leave that environment?
I will tell you that if someone is in that particular situation and they know that perhaps other authorities might be involved, say they live in housing or in an apartment complex where they're subject to inspections, there is an increased suspicion and distress that perhaps other people might go into their homes while they're gone. And that actually interferes with their ability to seek appropriate health care too.
I wondered about that. So you find that people, you know, just maybe don't pursue health care or seek care, like you say, or maybe delay it until it's really crisis mode?
Yes, unfortunately, it's mostly perhaps they might delay it until they feel that they can't manage it on their own anymore.
Do you do work with emergency medical personnel? Do you do trainings with them? Because as you're talking, I'm sitting here thinking, people have to know this, because again, think about all of the people that need to go into your home, right? So whether it's the fire department, the police department, you know, again, EMTs, paramedics, they need to know this stuff.
Absolutely. I do a lot of trainings for different emergency responders in terms of looking for safety hazards and being able to work even collaboratively with somebody. I'd hope that this message gets across that you should show the utmost empathy when working with someone who has a hoarding disorder or displaying hoarding behaviors. And in terms of those trainings, what that might focus on is perhaps safe egresses, making sure a front door should be able to open a full 90-degree angle, or pathways should be unobstructed and continuous throughout a home, so that the resident is able to ambulate safely throughout the home. And even emergency responders could get to the resident if, God forbid, they had fallen within their home. Hoarding accounts for 24% of all fire fatalities.
Is that right?
Which is an astounding figure, because clutter can interfere with basic functioning. It could interfere with pathways, even appliances. And because of that shame and embarrassment, oftentimes people in severe hoarding situations will not allow repair workers to come in because of that.
Wow.
So you might find that plumbing needs to be repaired, and there's new ways that the person has adapted and made use of their home that works for them, but unfortunately can still contribute to some of the unsanitary conditions within their home.
Now, you know, when I had talked to you earlier, you had mentioned with animals. Can you talk about that a little bit?
Yes. So we've spent our time here talking about hoarding disorder in terms of hoarding of objects, but there's still animal hoarding that is more of a taboo subject, if you can imagine, because people think that, well, there's animals and we have to think about the welfare of the animals, which is true, but we also need to think about the welfare of the individual as well, the resident. So just completing an animal raid would be along the same concept of completing a clean out. You're not addressing the underlying behaviors or that extreme emotional attachment to the animals. It's often that someone who hoards animals, it's more of an accidental thing, if you will, that perhaps they found an animal that was going to be put to sleep, for example, in a shelter or on the side of the road, and they felt that I could love this animal, I could care for this animal, and no one else would be able to treat and care for this animal the same way that I would.
Yeah.
But then you find that the numbers of animals start to increase and start to multiply.
Sure.
And for anyone, that could be incredibly overwhelming and even financially draining for the person, too.
Yeah. You must do, because what is the impact on families?
Yes.
You know, I mean, this has got to be really hard. So talk about that for a few, would you?
Yes, absolutely. This can create such an emotional strain on a lot of family members, and in a lot of ways can create some sort of animosity, if you will. And I find that some of my clients, that they've maintained a distance with their loved ones, with their offspring, or they're finding that their loved ones don't want to talk to them because of the hoarding, and felt that, you know what, you really need to work on this, Mom. Although they're working on this a great deal. And when
Is
I'm
it around shame and anger and all that with the family, or?
There is a lot of shame, anger, even a lack of empathy, if you will, that you've been working on this for all of your life. It's time to sort of clean up your act, if you will.
Yeah.
So in my program, we do family support groups. So these are support groups for family members of loved ones struggling with hoarding behaviors, to find ways to increase communication for themselves and set appropriate boundaries for themselves, while also educating on what hoarding disorder is.
Yeah.
So even some of the things that they might not know in their loved one, that they are working on this, or they are trying.
Boy, I'll tell you, it's so multi-layered, isn't it?
It absolutely
There's a lot to
is.
this. Is there a hereditary component?
Good question. So there is actually a genetic component associated with hoarding disorder. In fact, more than 3/4 of individuals with hoarding disorder report that they had a first-degree relative who also had some form of a hoarding problem.
Is that right?
Yes.
A very high percentage.
Yes, it is.
Wow.
Yes.
I'll tell you again. This is so interesting. Tell us more about, is there anything like that? I know I've missed a lot of questions. There's so much more to cover in this. It's not possible to cover every bit of it. Anything else, again, that comes to your mind that you want to make sure you hit on today?
I hope that if I can communicate a very important message today, that we're all individuals with unique needs. So if please refrain from using the term hoarder, because it is so highly stigmatizing, and you're really defining the person by the problem, as opposed to seeing Mary for who Mary is, for example.
So what are the words? Tell me the words what should people say?
Perhaps someone with hoarding behavior, someone who hoards, someone who has hoarding disorder.
So stay away from the name calling or the labeling, as you say, if you will, and talk about the behavior, really.
Correct.
Okay.
Yes.
So how can people reach you? If there is, they in terms of a referral, a resource, how can they get a hold of you?
So just by going to North Shore Elder Services at nselder.org, you can complete a referral online, or even call our main number and ask for more information about our program.
Excellent. We have your contact up there right now, which is really important. You know, it's like I said, this is really, I can't thank you enough for coming on the show. This is really important information.
Thank you for having me.
And I'm so happy that you're out there, because I think people must feel very isolated and alone and not know what kinds of resources. And clearly, you have a very well-established program over there, and I hope people will reach out. So thanks again for being on the show.
Thank you.
And I want to thank everybody for tuning in to today's show. Thank you for tuning in to Timing is Everything, and we'll look forward to seeing you on our next show.
Care Dimensions, formerly Hospice of the North Shore in Greater Boston, is different in that we do more than just hospice.
It's just incredible, the services they provide when people need it the most.
So being able to offer more individualized care helps people feel more cared for.
Because it's about the patient's quality of life.
I don't think there's any place else in the Boston area like Care Dimensions.
At Care Dimensions, we'll take care of your family like you're a part of ours. Visit us at caredimensions.org.